Hi everyone, welcome to another webisode of The Good Doctor on eZeLiving.com. On today's webisode, we're going to be talking about sinuses. What is it? How do we get it? What are some of the cures? On this show is Dr. Hussam Tohmi. He's an ENT specialist from Harley Street Medical Center. So Dr. Hussam, first question that I have for you is we're going to be talking about sinuses. What is it and how do we know that we have it?
Okay, now sinuses, these are normal constituents of our face or our skull. Normally these are like pockets filled with air within the head. And normally they don't cause any problem unless they are really infected or inflamed. So the symptoms are mainly the headaches presented with, the nasal congestion, the obstruction, in addition to the nasal discharge. And this is what we call sinus infection or sinusitis. It can be acute, depending on the duration, or chronic. And in cases of acute sinusitis, normally the treatment is medical, that is, we give decongestant and antibiotics. And whenever the things progress into a chronic sinus infection, sometimes one of the things that we may do or to help these patients is to have a sinus surgery done.
So are we born with sinuses?
Yes.
Or is it something that we can get over the years?
No.
How do we get it?
The sinuses are present since birth,
Okay.
but as the child grow, new sinuses will like start forming until maybe you get to the age of 5 or 6 years where the sinuses are there. As the face and the head grow, the sinuses also gets bigger. So these are normal structures within the head.
What can go wrong with the sinuses?
The sinuses, normally, these are like air pockets within the skull, and they end up with small exit sites to the nose. These exit sites, if these sites are blocked, be it by inflammation, by flu, by allergy, the mucus within the sinuses will start accumulating within, and then you will have a built-in or secondary infection. And then the symptoms started, like having facial pains, like having headaches, like having nasal congestion and blockage. So this is the main, let's say the main etiology or main causative factor for sinus infections as it's building up.
And how can we prevent it?
Now the way to prevent it is to prevent the flu or having a common cold, and to treat the allergies once they are occurring. This way we can prevent having the secondary infection within the sinuses. Now once it happens, then you have to cure it, you have to treat it. Now the first line of management is medical treatment, like you give antibiotics, decongestant, nasal sprays, mucolytics, and in addition to other measures that are given to the patients. In some cases, like whenever you have a chronic infection within the sinuses, whenever you have a deviated nasal septum or hypertrophied turbinates, and the symptoms have been going on for a long time, then we advise these patients normally to have a sinus surgery done. Now, with the new technology that we have, we can do a sinus surgery via using the telescopes. It can be done in the operating room with the help of the TV monitors, with or without the correction of the deviation of the septum. So at the end of the day, the patient will have a patent nasal airway, he can breathe well, and we can prevent in this manner the recurrence of the infections.
Thank you very much for this insightful information. It was fascinating. If you've got any thoughts, questions about sinuses, the symptoms, and some of the procedures that are available today, please leave them in the comment section down below, and the good doctor will be happy to answer. Thanks for watching eZeLiving.com, where you can find anything and everything lifestyle.